I'm Christin. I'm a survivor of necrotizing fasciitis. I contracted necrotizing fasciitis in January 2018. I spent 24 days in a sedated coma as they debrided, removed the infection, and healed me with wound vacs, antibiotics, and until I was healthy enough to wake up and breathe and survive on my own. My time in the hospital included learning how to swallow and talk again from being intubated for so long, several surgeries to replace and change my wound vacs. Grafting was done in about 3 sections. I had a lateral flap that was put in to fill up the axilla area that was damaged where the NF started, including lots of OT and PT. In my time in the hospital, I had a lot of people behind me. My family, my husband, my children, my in-laws, my mom, my sister, my wonderful, wonderful best friends, students from my current school and my previous school. I am a special education teacher. I have been teaching for 17 years, and I've been at several schools, and they all were aware of my story and supporting me through prayer, notes, and even fundraising. In my time in the hospital, I of course had a lot of time to think, and what I thought about was that to be expected, why me? Why did this happen to me? But I tried to change that around because I was there, I was alive, and I had basically been given a second chance at life. And I thought, okay, what's it going to be like moving forward? And I thought of all these wonderful people who were standing by my side, encouraging me, telling me wonderful things that I hadn't thought about myself. And I just looked at my husband who wouldn't leave my side and my children who were waiting for me to come home. And I just told myself, you've got so many people behind you. You have a lot to live for. And I had a job that I had students that were waiting for me to come back and teach. And in my head, I just couldn't let them down. And that was a constant motivation for me each and every day when things were so hard and so painful. I just couldn't give up. When I reached the end of my stay at the hospital, which was about 75 days in total, my husband and I had the conversation of me returning back to work. And he told me that he didn't want me to have to worry about finances, that if I needed to, I could take the year off of school. I looked at him, smiled, and said, I have to go back. That's me. And if I'm going to get back on my feet and be Christin again, I need to go back. And when I got home, it was hard. It was like bringing an infant home. But with my mom's help for the next couple of months until school was out for my children, I focused on the exercises I needed to in my occupational therapy and my physical therapy classes. I worked at home all the time on stretching out these muscles, getting my arm and my mobility back, walking again, getting my fine motor back. I had my kids work with me, and my husband helped me, my mom helped me, my friends helped me, and I just kept smiling, thinking, I have so many people wanting me to get back to who I am. I got to keep going. I got to keep going. I got to do this for them. I got to do this for me. I was able to graduate my occupational therapy in July after I was discharged. That was a total of 4 months. And talked to my doctors, and I said, hey, is there anything holding me back from going back and teaching? And they just looked at me and said, no, you did great. You're ready. And got my district to agree I was ready, and I went back to work. And that was such a huge accomplishment for me. The necrotizing fasciitis destroyed 30% of my soft tissue, which means I have a very large scar. It runs from the top of my shoulder down my breast, my torso, to the side of my torso, down through the left of my groin. It's large. It's hard to hide. I had dealt with a lot of self-image issues in the beginning when everything was very inflamed and very painful, and I felt the happiest when I was in occupational therapy and physical therapy because I could really see what my body could do. And I loved when the people I was working with were like, you got this, keep going, I bet you can get me some more. And they knew what to say. And I was so lucky to have such wonderful professionals helping me and caring for me, because I knew they wanted me to get on my feet just about as much as I did. So I just kept thinking, I'm here, I'm alive. We all are dealt cards that we don't necessarily like in life. And it's up to us to figure out how we're going to use those cards. And that's what I kept telling myself when I would look in the mirror and think, ugh. But then I would smile and think, gosh, look at that. I healed. I'm back together again. I'm holding my children. I was able to pick up my 3-year-old son. And after not barely being able to hold a pen in the hospital just months earlier, I was so proud of where I'd come. And my kids didn't look at me any different. As long as I was able to do the things I did before as their mom, I was still mom. So I started to let go the image, and I embraced each time someone commented on the scars. Where'd you get those from? Wow, that looks like it hurt. And I would smile, and I would think of it as a teaching moment. As teachers, thought of it as a teaching moment, and I just tell them about what it was. And it's amazing how many people don't know what necrotizing fasciitis is. Some days can be struggles, as my scars are on my left side, taking up half my torso. If I gain weight, when I gain weight, it tends to look a little lopsided. So it can be kind of a fight to keep up with that, but at the same time, it's a great motivation for me to continue to stay active and feel healthy, because when I feel healthy, I feel good. And I tell my children that when I am eating a little healthier, saying no to some things, or I say I need to go out and exercise, and they think, well, Mom, you're not fat. And so it's a nice, again, teaching moment, explaining to them it's not just being fat or overweight that you need to exercise. It's being healthy, keeping your heart healthy. And I explain to them all the time, that's why I'm still here, because I was healthy before I got sick, and I want to keep staying healthy so I can be here with you and do the things we want to do. So I just want to say to fellow survivors out there that when you go through rough times, looking at your body and not happy with the image, close your eyes and just picture yourself doing the things that you love to do, no matter what that is. Dancing, painting, reading, hiking, biking, what have you. Imagine how happy you are and how you feel when you're in that act, and get yourself back to doing that. Because no matter what we might look like on the outside, and as long as you have a will, you will find a way to get there.